all of this is going to be your conjunctiva, right? We'll talk about the conjunctiva later. Okay, and then this would be like your eyeball. And so what is this? Optic nerve. What cranial nerve is it? Two, correct. And then here you're going to have, that's your sclera. And so this is going to be your cornea, correct? And then all of this is going to be, well, no, the fovea, remember that you're going to have here, this is your, the whole thing is this here is your retina, okay? So this is your optic nerve, that's where your nerve starts. You see where all of it comes out? That's your optic nerve. And this is going to be the macula with the fovea in the center. The macula is your area of greatest visual acuity. So when you do very small work, that's going to be your macula, and the center of the macula is the fovea. It says here fovea central, macula lutea because it's yellow, and fovea centralis. If you tell me macula and fovea, I'm happy. Everybody understands what you're talking about. So this is what?
Your central optic canal.
Optic canal, which is this one, right? And then this is the whole thing is your
macula.
Macula in the center is your
Fovea.
Which is your area of
Greatest
visual acuity. And then remember I showed you this today. So this is going to be, that's your optic chiasm, remember? That's where they decusate. So these are going to go to your occipital lobe. And then here, I'm not going to ask them here, but you have here all your rectus, right? Your oblique, superior, inferior, your lateralis, your medial. So you need to know that, but probably I'll ask them on the other drawing. Then here, let me see. So here it has, again, this is just the lens, but some of these are like, in one of these it calls for the aqueous humor and for your, what is it? Aqueous humor, which is your anterior chamber. That's where you're going to have that fluid there. When we open the sheep's eye, you're going to see that, okay? And they call where's your conjunctiva? That's your conjunctiva. This is going to be, you've seen people that go like that, and you can see. So that's your palpebral conjunctiva, and then this one is your ocular conjunctiva. That's the one that gets infected. Yeah, that's what they're calling it. And then all of these here, those are going to be your ciliary muscles. Your ciliary muscles are the ones that move your lens, and that's what focuses on stuff. Okay. Here I'm not going to ask the retina. I'll ask you on the drawings over there. This is the retina, and this is going to be again the ciliary muscle, and then that's again the lens and the pupil, right? So that's about it. Again, the cornea is the anterior most. So that's it. And then the ear. Some of you have already seen this, right? Remember, that's the cochlea. So you're going to have 3 vestibules, right? Your what? What is this one? That's your tympanic. This is your cochlear, and this is your vestibular. One more time. Tympanic, cochlear, vestibular. Remember, Carlos? The one you saw? Okay. So on the slide, the bottom one is going to be your tympanic, cochlear, vestibular. And then here, that's where you're going to have that organ of Corti, which that's where you have the little slide with the tympanic membrane and the little hair that you saw the other day. Okay, we'll go through that. And then here, what do you have? You have external ear, middle ear where you have the bones, and then your inner ear. And then, so here, remember that we said this is your tympanic membrane that is attached to your what? Malleus, incus, stapes. And then here, you're going to have, so this is your oval window. So your oval window is attached to the stapes. And then this is your round window. The round window is the one that is attached to your eustachian tube. So that's when you go, that you feel like your ears are clogged, and then you equilibrate your atmospheric pressure with your inner ear, and that's why it feels good, because it goes through here that you're going to have. So this is your eustachian tube. See, that's your eustachian tube, or auditory tube, they can call it too. Okay? So that's your cochlea, and that's your vestibular apparatus. Which cranial nerve is this one, guys?
Vestibular cochlear, right?
which is what?
Number 8.
Number 8. Thank you. Okay? So again, you can have the bones here or here. And then here, again, this is the cochlea. Oh, and these are your semicircular canals. Guys, be very careful. Today, I'll grab the ears in the back, but each ear has one. Some of them are A, B, or C. Make sure that you grab the correct key, because some of the canals are labeled differently, not incorrectly, but they are different keys. And that's very easy to make a mistake, and then students complain the day of the test because they know when they didn't make a mistake, and they come and say, oh, I'm sure, I'm positive. And now, maybe you have the wrong key. Okay? So make sure that you have them, because here, the way they label them, they just put here sensation of motion. They don't have them like labeled, so the horizontal, anterior, and posterior are better on that one. Okay? So that's it. Okay? Very easy, but you just have to learn them. Okay? Oh, yeah. Do me a favor. Let me help you move these guys to the other room, because I think they're just there on the way, and Gloria can